Joint capsule here, this area here, this is where rotator cuff tendons blend into the ligaments in the joint capsule. So the shoulder above all joints, the distinction between ligaments and tendons, between inside and outside the joint, between muscles and dynamic control and intrinsic ligamentous stability is less distinct because the shoulder is so highly mobile. An awful lot of the stability is actually muscular, is provided by the rotator cuff. But nonetheless, this anterior capsule can get stretched out, and then the labrum is, like I said, is kind of a rubber gasket around the glenoid fossa. We call a ball and socket. It's a very shallow socket. It's probably more like a saucer on a teacup that the ball of the shoulder of the humerus sort of pivots and swings around on. But so those are my two areas, is sort of here along the glenoid labrum and the line of the joint line itself, and then out here a little bit more on the front of the shoulder capsule. And then when I go to the bottom side, I can't demonstrate this on the model so well, but it's going to be up through here to the bottom of the capsule and the bottom of the labrum. Kind of a bony crack in between the head of the humerus and the lip of the glenoid fossa. And I'm going to look at her face. There's those involuntary flinching or grimacing there. So that's one spot there, a little tender hump. So I'm right about at, I'm going to say about 11 o'clock. So that's where I'm going to go in with a perpendicular insertion. And you just tell me at any time if you need me to stop or give you a break. And I'm going to kind of probe and poke. And what I'm looking for is a dull, achy sensation, particularly if it refers somewhere. What are you feeling? Dull ache going down the arm. Okay, so that's exactly what I'm looking for and expecting. Okay.
It's very minor.
Very minor? Okay. Mm-hmm. So I'm going to keep probing and poking around, just slightly changing the needle angle, just trying to get coverage of the entire area. So while I'm doing this, Betsy, you tell me at any time if you need a break, but I'm just going to talk a little bit more about distinctions, and you can just wave your hand too on the right side if you need a break. Okay. The dry version of this prolo-acupuncture versus the wet versions, if you will, prolotherapy and platelet-rich plasma injections. With the irritant solutions, there is a benefit to that because they diffuse throughout the entire area, and same thing with the platelet-rich plasma. So if a patient isn't responding to this with a dry needle, that's one step up short of surgery, is simply try some prolotherapy, try some PRP. The differences are they're much more expensive, but they're not covered by insurance. So it's hard to find a physician. Some locales, I mean, in my hometown of Santa Cruz, there was a couple docs who used to do it, and then their malpractice insurance didn't like them doing it, and it wasn't covered by insurance, and so they just kind of stopped doing it. It can be hard to find, so you may not have anyone in your local community who can do this. But if you do, it is more expensive. It is typically much more painful. They use a much thicker gauge needle, and the irritant solution itself is really uncomfortable. I actually had some prolotherapy in my sacroiliac joint 10 years ago or so, and the third session was so painful I called up one of my acupuncture friends who came over and gave me an acupuncture treatment to control the pain from the prolotherapy. So, but it can work very well. I've had it on my knee with excellent results. So
I had some in the same area of the shoulder joint, and it did not hurt.
Not
did not
much.
hurt. Okay.
3 times. And
Good. Yeah.
said it might be painful, but
It wasn't. And what did you just feel, Betsy?
I just feel pressure, like right there. It was a little sort of pricky feeling, or a little edge of sharp.
Okay. And now I'm a little bit deeper in there, and it feels a little more gummy and sticky.
Sort of heavy.
Heavy sensation. That's really typical Dutchy sensation from this. So somebody else had a question?
I was just asking, what are you feeling at the end?
Yeah. Oh, what am I feeling at my end? Kind of a little bit gummy and sticky. Like the needle's in a little crack that's filled with glue.
So as you mentioned coverage, are you looking to fan around the area?
Exactly, yeah. I'm going up. So along the joint line, I'm mostly just kind of going up and down rather than side to side. But inferior and superior, just changing the angle. More achy up there?
Yeah.
Yeah, so as I go upwards, you're getting a stronger sensation. So my starting point was around 10:30, but my needle tip is more around 11 o'clock now, going up the clock face.
Yeah, it's more intense.
Yeah, probably superficially in the labrum. I can just tell by the depth of the needle that I'm not all the way in there, but a little more intense up there, huh? Okay.
And how do you decide how long you're doing it for? Feel?
Yeah, kind of. So if I'm getting referred pain or achiness, ideally I do it until she kind of stops feeling that. But generally, roughly speaking, I'm going to do this for a couple minutes and then recheck. You know, it depends on the severity of the joint, of the sprain, or the laxity and the size of the joint and stuff. But this would actually probably be a good point. We can probably recheck now and see. And I'll generally recheck between each needle because, you know, if I've got it stabilized, I don't need to do anymore. I don't need to keep going.
So does the response actually work throughout the ligament, or is it responding locally?
It's more locally, but that's all we need because it's just locally. There's typically one spot where it's stretched out or torn or frayed, and that's really all we need. Okay, so I'm going to take that needle out, reach my fingers underneath to the medial border of the scapula and pull the whole scapula laterally, just giving me more space to work there. And then sometimes in a clinic, and I'll ask an assistant to hold the arm if I can't support it with pillows. Maybe more comfortable to have somebody hold it. But I want her to be able to fully relax her arm in this position. And this table is just a little bit narrow, but does that feel all right? Is that reasonably stable there?
Right.
Would you like somebody here just to hold your arm, just to provide extra support? Would that be?
Like, so it's resting more?
Yeah,
or-
just somebody's hand here, just so that you don't worry that it's going to slip off the table. I think that'd be good. So I'm just going to put my fingers in the axilla. And as I go, I'm also feeling for the underside of the glenohumeral joint, the little crack between bones. And if I can feel that, and I don't feel the brachial artery or plexus on the way in, then I know it's like, okay, well, I didn't feel the artery, but I don't need to because I found my target tissue and it doesn't seem to be near the artery. The reason that I emphasize the palpation part of this is the textbook will tell you where most people have it most of the time, but they don't tell you for sure where your patient has it right now, right? Okay, so right here, I feel the joint line. I feel a crack between the bones. Is that achy or tender there at all? It is, okay. And none of my fingers here can feel the brachial artery or the brachial plexus, so I think I'm good to go. Okay, now this is a little bit tricky because I got my finger right where I want to put the needle, but my finger is not really my target. Okay, so I got to kind of roll my finger out of the way with one hand while I go right into where I was with the other hand, and then I angle up towards that little crack that I just felt. And notice how my left hand here, my non-needling hand, is also flush up to the rib cage, so I can feel where the rib cage is, and I know that I'm blocking the needle from going into the pleural cavity that way. Okay. And what I'm looking for is achy sensation. Yeah? Kind of achy there?
I'm feeling it going down my arm.
Okay, she's feeling it going down her arm, which is again what I want. Or I mean, it tells me I'm in a zone of therapeutic importance, and I feel a little kind of gummy, but mostly I'm feeling bone. I want to change the angle slightly until I really get that kind of gummy feeling on top of the bone, because that's really joint capsule. I'm just going to probe and poke and peck around a little bit. Yeah, achy there too, huh? Okay. Okay, so I'm going to guess that that's enough. I might be wrong, but